Right. Hi, this is Dr. David Tenner. We're here at the Goldberg Tenner Clinic just outside of Atlanta, Georgia, and we specialize in the reversal of chronic health issues and chronic diseases. And today I'm delighted to be joined by Ms. Neviana Nedelchev. She is from Ontario in Canada, and she came to see us back in January of 2020. It's now May 2020, about 5 months later. Neviana would normally be coming back to see us at this point for an in-person visit, but with the whole COVID situation, we are doing a visit over Skype today, and Neviana is here. She's going to share her story and talk a little bit about the significant improvements that she's had. So, Neviana, tell our audience a little bit about what brought you in originally, what kind of health problems you were having.
What originally brought me in is I had suffered with colitis since I was 23. I'm now 37 years old, and I thought, I could control with my diet and do everything that I possibly can to eat right because that was going to cure it. But I tried for 10 years and nothing worked for me. Actually, I got worse and worse. I was actually also diagnosed with breast cancer when I was 32 years old, and which kind of escalated me to dig deeper into a different healing. And I had come to you guys with symptoms of bleeding in my bowels again, and I was scared. I had lost a lot of weight. I didn't know what to do, and I knew that the path I had taken before wasn't working for me. So I really needed to figure out a way to find a different way to heal because I knew healing was possible.
Mm-hmm. So Neviana found us through the folks at listentoyourgut.com. Through Miss Ginny Patel, who Dr. Goldberg has done a couple interviews with. I think you had watched the interviews with Ginny, and
yes.
We're glad that you found us. And when she came in, we did a thorough evaluation. We spent a good 90 minutes or so with you, just interviewing you. Every patient that comes in with ulcerative colitis is different. Each person has a different history, a different story to tell. They have different exam findings. Their lab work's going to look different. And so we know when we met Neviana that we really had to do some digging, some investigative work to figure out specifically what factors were driving her issues. And her story really isn't unlike many of the patients that we see. Most patients with colitis end up on what we call the diet train, so to speak, where they go from one diet to another, trying to figure out what foods they can eat, what foods they react to. But as we discussed, the problem in cases of colitis and other chronic health issues is not so much with the patient's eating, but with how the body is receiving that food and what happens to it once it gets inside, how it interacts with the immune system and how the different digestive organs are working to break that food down.
Yeah.
And in Neviana's case, we did some testing and we found that she was having some significant difficulty breaking down that food. It wasn't so much a problem with the food, but what was happening to it once it got inside. And there are many, many, many factors that can influence that process. So Neviana tell us a little bit about how you're feeling now, what the changes have been, and then I'd like you to talk about the factors that we identified with you as the primary contributors to your problems and how you went about addressing them.
Well, when I came to you guys, I had lost a lot of weight. I was extremely stressed because I just don't know which way to go. I was tired of being treated as the same as everybody else. Take the drugs, do the colonoscopy, and go home and figure it out. I knew that I needed to find something that is going to treat me for who I am, with my background, with I'm Neviana. I'm not the same as anybody else. I had a lot of bloating, everything that colitis patient would have, mucus in the stool, bleeding, and the difference now is I thought when I was in remission at times that, oh my gosh, look at my bowels, they're amazing. And what I'm experiencing now, as I mentioned earlier when we were talking, is it's been probably 17 years since I've actually had this type of change in digestion. Not only am I eating good, but my food is being digested. It's I'm seeing, I could say miracle bowel movements in the toilet, which is absolutely incredible. And I've had to work hard to get to where I'm at and understand that food was not actually the cause of this. And it was mostly my emotional reaction and my emotional distress that was actually causing a lot of my digestible issues.
Mm-hmm. And that's common in many of the cases that we see. One, because the disease itself, as we had discussed, creates a fair amount of anxiety for patients. But oftentimes there are some underlying emotional issues that are contributing to the problem as well. In some cases, more significant than others, but I've seen enough patients over the 10 years I've been here, and I've heard Dr. Goldberg lecture on this topic as well, about the role that our emotions play, particularly in digestive issues. Dr. Goldberg used to lecture to the students at the college for 38 years, and he talked about the significant interaction between what happens in the mind and what happens in the gut. And he oftentimes says, when the mind gets right, the gut gets right. That's a
Absolutely.
line I'll never forget, having attended many of his lectures, and I use that with many of the patients we see here too. And interestingly, it's another facet that Jeannie Patel talks quite a bit about in her books, which you, I think, has
I read her books like over and over and over and over, and I bought every single book that she has, and I did her tapping that she has on YouTube. And you guys also mentioned to bring tapping into my life as well. I tap when I drive now sometimes. As soon as I feel a type of emotion come through, and I know it's not the emotion I want to feel, I tap into I tap through it.
Mm-hmm. So you have done a fantastic job to kind of unearth some of the emotional traumas that you've been through in the past and release them. We called that earlier today, as we were talking, a detoxification of sorts, just an emotional detoxification. And as a result, your health and your digestive system have become much better balanced. So as I understand, you're not having any blood in your stool. You're having virtually no indigestion. When you eat, your body is now receiving food better. Is that correct?
Absolutely. Yeah.
How's your
big thing? My energy is fantastic. Like I said, I feel very almost not blurred.
Mm-hmm.
I feel very focused. I feel very strong in how I speak and what I say. I have boundaries with, I can eat this or I don't want to eat that, instead of making a lot of choices out of fear, which I was doing for a very long time. Alone for 10 years, I played the fear game when I was chronically inflamed and bleeding, that I was constantly afraid to eat this or eat that, which also created pretty much a food disorder in its own, because at the end, I think I was just eating bananas because I was so afraid of putting anything in my body that was going to harm me. But I really had to dig deeper to say, it's not actually the food that I'm eating that's harming me. It's actually the energy and the environment I'm creating with my thoughts that's causing this not to break down. With my thoughts, I was causing stress on my internal organs. And when I really realized that I could drink the green juice and the green smoothies, whatever I was giving my body, but my organs were pretty much frozen in fear and resentment. I felt very much unloved and unsafe. And once I started turning that around, and not believing it, that I was that type of person, and really creating who I really wanted to be, things really started to shift for me drastically.
Mm-hmm. Mm-hmm. And yeah, so wonderful transformation that you've made. And this is something that we try to encourage patients when we work with them, is not just to focus so much on their diet and what they're eating, but to look at their entire environment and the conditions of their life that are either creating disease or creating health. And we must, commend you in the process here, because what we were able to accomplish with you was do a thorough evaluation and to point you in the right direction based on our interview of you and doing a physical exam and getting the appropriate lab work to say, Neviana, these are the real issues that we think are contributing to your condition. And now with our guidance, it's going to be up to you to kind of take the bull by the horns and start addressing it. And you really did. You had the will to get well. You took the right steps. You took control of your health, essentially, with our support and guidance. But you deserve a lot of the credit. So congratulations to you on the tremendous turnaround that you've made. We're absolutely delighted. We're going to do some follow-up testing now to make sure that we've got all of our ducks in a row and see if any loose ends we need to tie up. But your case is a fantastic example of the type of change that can occur when you take the right steps to address causal factors, not just cover up symptoms with drugs and pills and potions and therapies and things that people get into, but to really get down to the sources of the problem, address them, and then recreate your body, as we call it, through the Goldberg tenor biohygienic reproduction system. So